Well, there are various databases that have clinical information that may be relevant about products. They could be drugs, devices, procedures. Some of them are databases that are owned or controlled by the government, databases that FDA might have, like some of the safety databases that FDA is working on, where access to those databases by researchers who might be able to conduct research that would be informative about the use of products or procedures in patient management don't have access to the data in order to do that kind of research. You have payers who have various databases that have a wealth of claims type of data. There are limitations in claims data because they don't necessarily have the same kind of endpoints you might have in a clinical trial, but often you can learn a lot about the impact of various services with other services patients may receive or outcomes that patients may have. And those databases also can be limited. I think the fact that we have rich data sources and that there may be folks who may be able to use them to explore either hypothesis generation or data that might help drive patient management would be a good thing to open those databases in order to have information that can help providers and patients. Always have to recognize that there may be reasons why a database is limited. Sometimes it's for proprietary purposes, sometimes it's for privacy purposes, but I think trying to have mechanisms to address those and to make data more available is generally going to be a good thing. If it's a database that is kind of controlled by the government, I would think there we should have the broadest access to it because essentially it is a public good. Now, insofar as it might have patient identifiable information that would create concerns from a privacy perspective, there are mechanisms under HIPAA today to create limited data sets that would allow the data to be released. If it's proprietary, sometimes what could be done is there may be pieces of the database that would have very useful information where the proprietary information could be blanked out. Some of these data sets now are being made available, but only being made available to, say, academic researchers at a not-for-profit institution. Part of the view there is that an academic researcher at a not-for-profit has purely a public good research motive in conducting the research. Well, I wouldn't challenge that, but many academic centers are major providers. They have a financial interest in the outcomes of the data, just like some other commercial interests. So rather than looking to the corporate form in which the researcher operates, it should be more open access and I think more peer review processes to the quality of the scientific question someone might have, or having more open access in terms of then dissemination of the information, looking at peer review as being the gatekeeper rather than you can't have access to the data because you work for a for-profit company. When you have gatekeepers of information, controlling what information gets out, obviously for a positive public health purpose, but where that can limit access to data that might be useful for decision making today, it would seem appropriate to try and lower some of those barriers to get the information out, but at the same time trying to have structures or mechanisms so that there could be some third-party vetting of the information, standardized formats in release of the information, making sure that the limitations on the information are clear.